So, good morning, viewers, and it is an immense pleasure for me to welcome you all for yet another online special talk series on the occasion of this World Health Talk. So, today we are honored to have with us a highly experienced and dedicated expertise, Miss and Dr. Jyotsna ma'am, who holds an MD degree in naturopathy with an impressive 14 years of clinical and academic experience. She has made significant contribution to the holistic health and wellness. She is currently heading the Department of Diagnostic Method in Naturopathy at JSS Institute of Naturopathy and Yogic Science, where she plays a vital role in guiding students and advancing diagnostic approaches in naturopathy. Her expertise and commitment and passion for natural healing make her an inspiring speaker today. Without further delay, I would like to call upon Dr. Jyotsna ma'am for the health talks. Thank you.
Welcome everyone, and thank you so much, Dr. Arya, for those special words. So we'll slowly move on to the today's health talk based on World Health Day, because we are celebrating April 7th as World Health Day. So this year's 2026 World Health Day theme is World Health Day with Science. So that is the theme this year. So we'll just go ahead with a few introduction of what is World Health Day. So every year on 7th of April across the whole world, it is celebrated. So this is under the leadership of World Health Organization. The basic aim is to attract people's attention towards the importance of health and its various aspects. So every year they will be having a different theme, and they want to concentrate on work on it, and they want a particular all mass people's awareness on it. So all these are the basic aim of why they are celebrating global health or World Health Day. So a little bit of history. So World Health Assembly was held first time in the year 1948 in Geneva. So this is so coming to the World Health Day. This is celebrated worldwide by the government and non-government organizations. For example, our JSS is a non-government organization, is celebrating now through a health talk, and other NGOs, including various health organizations, will be celebrating. So there is no difference between whether it is a government or non-government. Everybody, all who are related with the health sector, not related with health sector, like example, schools, colleges, they will also be celebrating this. So how they celebrate is usually through their activities and supports through the media, and for example, camps conducted, and highlighting all this and putting it in newspapers, social media like Instagram, Facebook, so all the press release, so this TV news. So this is how the activities go ahead. And so health authorities from different country will take part in the celebration with their pledges. So they will do an extra mile by doing their pledges plus the activities, especially the government health authorities. So in order to, so this is basic, again, the basic aim is to support the health issues worldwide. So this is like almost a unifying the healthcare around the world. So generally, few examples of other activities are debates, then art exhibitions, essay writing, and competitions, award ceremonies, everything related with the World Health Day. So these are the activities organized. So now we will move on to the basic concept. So health. So ultimately, the aim is everybody, the mass people should be healthy. So we'll just see what is health. Okay. So different people have different perceptions of health. Some feel that individuals are said to be healthy if he or she is able to perform activities of daily living normally. For example, according to this is a simple definition, because if a person is able to do the basic daily activities, example, eating, healthy, bathing, dressing, then getting transported or transferred, toileting, walking and moving around. If this a person is able to do by self, then we consider it as health. So this is like the simplest definition. But some people will feel take it to next level. So some people feel that an individual is healthy if he or she is well adjusted in social life also, and can even function in stressful situations. So that also now coming under consideration of the definition of health. So another, according to Oxford English Dictionary, the health definition is soundness of body or mind, that condition in which their functions are duly and efficiently discharged. So not just the basic daily activities are met, plus they are efficient to the society also, like helping others uh, in their activities, and taking part in jobs in a healthy way, taking part in the social activities in a healthy way also. So it is not just person centered and daily activity centered. Next is, according to Perkin, health is a state of relative equilibrium of body, form, and function, which result in successful dynamic adjustment to forces tending to disturb it. So we can explain it like this. Suppose it's an equilibrium of a human being in all aspects. So that's something, a dynamic adjustment to forces tending to disturb it. For example, a person is exposed to a unclean environment, or unclean water supply is happening. So whether the body is responding with immunity, or the body is frequently falling sick, or so all these. So even though the disturbances are coming from, for example, a person living in a metropolitan city like Delhi, where the pollution is high. So whether the person is able to adjust, or the immune power is sufficiently enough to handle it, or the patient is very frequently falling sick due to that pollution or the polluted air. So that is something meant here. It is not a passive interplay between body substance and forces impinging upon it, but an active response of body forces working towards readjustment. So it's not just about the health, doesn't mean that the body substance is right now okay. But whenever an external force which is against health is coming, whether the body is able to fight back or readjust. So that is the definition according to Perkin. And based on some experts, health is a relative concept. This may be due to ecological conditions and the fact that standards of health vary among cultures. The ecological condition means all the environmental factors will determining the health also, plus culture. See, culture means there are certain cultures in which especially women are considered, women with obesity are considered healthy. So grade 1 and grade 2, not grade 3. So grade 1, grade 2 obesity is considered healthy in certain cultures. But when you look in a like a pathological or in a lab related, blood report related angle, that is not healthy at all. But some cultures consider it as healthy. So social classes and age groups, so that also vary based on this also can influence the health. So, but we will go ahead with one more classification, that is by World Health Organization. So this is the most accepted one. So health is a state of complete physical. So physical means we can see the person is able to do all the daily activities like bathing, cleaning, this self-walking and moving around. Next is mental. So mental means the person is mentally healthy to do his basic needs, plus when a stressful situation is coming also, he is able to positively respond to it without harming himself or anybody around him. Next is social. He is, for example, social means he is a productive person in the society, like he is contributing something to the society, and he is helping the society to run and in a smooth way, and in a positive way he is part of the society. And spiritual well-being. So spiritual well-being means it's like dependency and submissiveness to a force which has created this world, and not merely an absence of disease or infirmity. So health doesn't mean that there is no disease. Okay, health should be, so like health is a state of complete physical, mental, social, and spiritual well-being should be there, not just absence of disease. So this is a most accepted definition. And now we will look into the dimensions of health, or the different components of health. So first one is physical, which everybody is aware that the person is able to move around, do his daily jobs, then that is physical health. Mental health means he's happy, satisfied, plus he is able to make people around him also, he's responding to other people also in a positive way. Plus, when a stressful situation is coming, he is responding in a positive way so that it doesn't harm himself or the others in the society. Next is social. So social means he is a contributor to the society. And next is spiritual. So it the dependency attitude of somebody who created it. So humbleness. So the basic human values of kindness, humbleness, dependency on a power above us. So these are all the attitude. These are all small aspects of attitude, but which have a great influence on health. So these are few examples of social aspect. For example, one is school. See, school. Suppose a student is abused in school or bullied in school, so that is his mental health can be affected if we are not taking care of that kid. Or next is family circumstances. Example, the father is an alcoholic, then the child's mental health and stress will be little bit high. Then peers, friends. So if the friends are, for example, if the friends are smoking or going with the bad habits, so due to peer pressure, that person may also start smoking or taking alcohol. So this also affects the health. Coming to the psychological, one example they have given us self-esteem. So if the self-esteem is very low, so their behavior will be aggressive towards others. So this will work, this will be affecting their job and the relationship with the colleagues. So this is also unhealthy if you see it in a psychological aspect. Next is coping skills. like they have faced some trauma in their life, but they are not able to cope with, or they are not able to behave normally with other people, and not able to contribute to the society. For example, after a trauma, the person is confining himself, closing the doors, not going for job, not earning money, depending on somebody else in the family. So then it affects the health of the person. It even affects the nutrition of that person. So that is one thing. Then coming to the biological, any disabilities. So for example, a person has met with some road traffic accident, and few days they had to go for bed rest. So then that is a disability in which during a particular till recovery, that person's physical health or the biological health is going to be affected. So physical well-being means having the physical strength and energy to work towards our goal. So that is physical. Mental well-being means ability to cope with the world in a way that brings you satisfaction, that personal satisfaction. So that is mental health. Then social well-being means development of relationship with others, both with people in your immediate surroundings like family members, mother, brother, sister, cousins, and with a larger community through cultural, spiritual, and political activities. So that is regarding social and spiritual. So once again, we'll summarize the dimensions of components of health. One is spiritual health. Second is emotional health. So next is vocational health, also important. We'll just look into what is vocational health. See, for example, the choice of profession. If somebody is uh, the profession, and somebody has forced, especially those people who are forced into some professions due to family situations or the family pressure, don't like the job. So that is so it is very important. So this will be creating stress for them. They won't be enjoying and doing their job. So that will be affecting their mental health. So choice of profession. Next is job satisfaction. So for example, suppose a person is in a medical sector. So they are interested in clinicals, in handling patients and treating them and getting results will be their aim. But suppose they are posted in some office work related job or legal activities uh, signing dharma and all, so then they may not be fully satisfied with that. So next is career ambitions. So whatever their regarding their salaries, if they are not satisfied and it is not enough to run their family, so then it can be a problem, and that will be affecting, that will be giving the person a lot of stress. And personal performance in some jobs, the personal performance is highly under scrutiny, and it will be so they will be followed, and yes, even small feedbacks will be taken seriously. So that will be giving excessive stress. So minimum of personal performance assessment is okay, but when somebody is severely and meticulously following somebody's personal performance, and if they are not able to meet their targets, the company target or the money targets of the company, then that will also be giving them the unnecessary stress. So we can say vocational dimension of health can be assessed by the satisfaction level, facilities attached to the job. So some working conditions are very poor. So in that case, they won't be able to, they will be again mentally and even physically health. So no good water supplies there in their job location. So that is a serious problem. No hygienic environment. So that also physically also it can affect them. Then behavior of the management and administrator, severely scrutinizing and unnecessary involvement in their work, and so in that also can affect their mental and physical health. Next is ecological aspect of health. So according to this definition, the experts, how they explain ecological health is, It is a mutual relationship between living organism and their environment. So not just about, of course, the spiritual, mental, and the social aspect is there, plus the environmental factors, how they influence health. That is also important according to ecology concept. So, for example, uh, disease is a maladjustment of the human organism to the environment. So, according to ecologists, this is the reason. Like whenever there is the equilibrium between man and his environment is lost, that can be defined as an ecology. That can be defined as a disease. So, if a perfect man in imperfect environment is not good, and an imperfect man in a perfect environment is also not good. So it is actually a dynamic equilibrium. So this is the ecological model. So minimum health and maximum health. So minimum health also, it is not desirable. Maximum health is something which is which we should keep it as a goal, but it is not practically achievable. But we will try to move towards that. Okay. So it is in a healthy environment. We will be moving towards a maximum health. At least we are supposed to maintain the middle one or the medium health. So next is determinants of health. So these are the factors which determine or influence health. One is hereditary or human biology, or the genes, then socioeconomic conditions, then environmental conditions, then lifestyle, then health and health related services. So first we will look into the hereditary aspects. So that is nothing but the genetic makeup. There are large number of diseases which are of genetic origin. So from the genetic standpoint, so the health can be told the part of health. If a particular amount, the particular part of health is directly influenced by the genetic constitution with which you are born with. Next is environment. Environment can be divided into three aspects: physical, biological, and psychological. So when it, for example, physical environment means, for example, unhygienic water supplies coming to your location or your house, then that is a physical bad environmental influence. Second is biological. You are exposed to unhygienic surroundings. Means you are living in the waste disposal area, so where you are exposed to more of germs. Next, third one is psychological. So your relatives, or you are living in an area, or your immediate family members are alcoholic, smokers, or you are living in an area where a lot of drug abuse is happening. So these are all environmental influences. Next, we will look into the risk for illness and risk for illnesses. So one is lack of sanitation, then poor nutrition, then lack of personal hygiene. Next is elementary human habits. So elementary human habits, the meaning is those behaviors which are developed through repetition and it is ingrained in the life, like daily hygiene, daily communications, like taking bath, taking breakfast, lunch, and dinner properly on time. So all these the basic things, and sleeping on time. So all this comes under the elementary human habits. Next is customs. Customs is nothing but the long established habitual and commonly accepted practices of behaviors in society, especially during events like marriages, greetings, etc. So for example, how this can affect the health means, see, in some customs, once after marriage, they will feed a lot of including junk and unhealthy food to the bride, especially, so that they consider obesity as a healthy one. So in that case, even though the customs, their aim is good, but actually that will be affecting the health of the person. Next is cultural patterns. So cultural patterns are like, see, in some cultures, some certain health practices will be there. So especially regarding this delivery of the baby and all, how the maternal care should go ahead, how the prenatal care should go ahead. So some places it will be, they won't be much, uh, this scientific knowledge won't be there in that. So the traditional practices will be unhygienic and not based on scientific things. So in that case, those cultural patterns and cultural behaviors can be harmful for the health. Next is resources of health, socioeconomic conditions, economic status. So if you have more money, you can afford all kinds of nutritious food, supplements, everything. If you are poor, you won't be able to afford all the supplements. Then education. So if you are educated, you follow hygienic practices like after see even a small example like once you go to washroom, you come back and you will be using a hand wash if you are a highly educated person. So but sometimes uneducated, they won't be, they will be just maybe due to water supply less or no water availability may not be there in that case, and they're not much educated about the hand washing hygiene and all. So in that case, so that will also can cause health damage to the health. Next is occupation. So like there are some conditions where the some occupations where the health will be affected. For example, if they are working in especially industries where they have to handle a lot of harmful chemicals, or else if there are sometimes they may handle less harmful chemicals, but they'll be working for long years, many long years in that industries, and then that also can affect their health. Then the political system can affect their health. So when it comes to political system, see there are so next we will move on to health services. So this is also important. Health services are directed towards treatment of diseases and prevention of illnesses. So for example, what is health service means, like the OPDs available, immediate availability of a casualty, and all the pathology department, labs, physiotherapy, ICU, blood bank, all these services, ambulance service, all this comes under the health services. So if the health service, so for example, a person is living in a very remote village, uh, the basic health facilities are very far away from them, then also this can affect the health, because sometimes uh, suppose a person is falling sick, they are having a health issue, because facilities, health facilities or an ambulance is not immediately available, they are deciding not to go with the standard disease management procedures. Instead, they'll be staying in home or doing some home remedies or doing some other remedies which are easily available but not scientific. But in future, it can lead to some other harm to their health. So that is so that is the importance of health services, and if it is not available immediately for the person, then health services are essential for social and economic development also. Then even in the periphery, those who are living in periphery area should also, this should be effectively reaching. See other factors, these are small factors, but it also can have a good influence on the health. One is language. So language barrier can be seen everywhere. Uh, suppose a doctor is not communicating or the patient is highly uneducated and not understanding what the uh, doctor is telling, what time the medicine should be had, what time the medicine should not be had, and how to have the medications, how long it should be taken. So if that communication and language issues there, then that can also be a problem. And next is diet. See, some people are highly dependent on carbs alone. They are not from their, with their culture itself, they are not directly taking a lot of vegetables and all. In that case also it can damage. Next is hygiene. So hygiene definitely can affect the health. Then the habits like smoking and alcohol, this can affect the health. Then employment opportunities, then increased wages, prepaid medical programs, family support system. So all these can have a positive and negative influence on the health. So ultimately, one more definition we'll see of health. So according to Webster, the condition of being sound in body, mind, and or spirit, and especially free from physical disease or pain. So this can be considered as a healthy. So one more definition some experts are putting forward is positive health. A person who enjoys all the four dimensions of health is said to be in a state of positive health. So now we will slowly move on to the basic principles of nature cure towards health. So first thing is body heals itself. So for example, suppose a wound is there, a fracture has happened, a cut injury happened, bleeding happened. So all these, the body is healing itself. There is no medication so far to heal a wound. We go for stitching, of course. We go for putting a band-aid so that dust won't go inside the wound. And we give antibiotics so that no more infection happens there. And but still, the wound is healed by the body itself. So the healing is actually done by the body. So even if we are sick, so the naturopaths will be trying to promote the healing capacity or the healing attitude of the body will be increased, and we are just giving as a naturopath, we will be giving all the situations so that the healing of the body will be maximum. Next is the cause of innervation. So innervation means the nervous system working, the working of the nervous system, the mental and psychological causes are important, is considered important. So proper rest and sleep should be there. The stress should be managed effectively, highly effectively. Otherwise, they will go for the habits. Their daily activities will change, and their diet will be changing. So all these will be affecting their health. And then the type of waste matter, to be eliminated. So for example, once we remove all the waste matter from the body itself, the health can be retained. This is the one principle according to naturopathy. So types of waste is, one is catabolic waste matter. Next is undigested and unassimilated food. Next is any germs or parasites or any other foreign substance which are dead, or medicines, excessive medications when they are taken or when they are not metabolized and thrown out of the body on time. So in that case also, it can affect the health. Then according to naturopathy, acute disease is a remedial process and itself is not a cure. So for example, when a fever is coming, the body is trying to throw out the toxins, or self-healing the body is trying. So we have to accept it and we have to give support to that instead of suppressing the symptoms. So this will promote health. So this is another principle according to naturopathy. Next is food is a building material. So, but it does not increase vitality. So vitality is considered something like only for a living tissue you have vitality. So if you are giving food to a living tissue only, so it will be digested, absorbed, and used for the building purpose of the cells. But if you are giving food to a dead tissue, it's not going to use. So vitality is important. That is primary. And second thing is the food. So that means food is subordinate to life. So we have to try to improve the vitality of the person. Then fasting does not cure any disease, but provides an opportunity to body to heal itself. So I told you, whatever, even for a wound or a fracture, the healing is done by the body. It's not done by any medications or anything. So same thing, while we do fasting, the main aim is the fasting is not directly doing any magic to the disease. What is happening is fasting gives an ideal environment to the body so that the healing power will be maximum. So what the meaning of fasting is, abstinence from food, drinks, smoking, etc. Next is germs does not cause disease, but are uh, on the foundation of excessive toxic material deposition, the germs grow. See, for example, we would have noticed, see, infection, if suppose a germ or any bacteria or any virus is entering a body, the immune power is more than enough to fight it and make it ineffective. But what happens is, if the person is having a very poor lifestyle and their body compositions are changed from normal homeostasis, then what happens is they won't be able to properly fight the bacteria. The body won't be able to fight the bacteria and the viruses. And exercise is an activity which keeps the balance of nutrition and drainage. So always, so for example, life is in activity. So movement is part of life. So what we are supposed to do is exercise we have to follow so that whatever we eat, if any excess carbohydrates came inside the body, we are supposed to utilize it instead of promoting it to get deposited in the body. So that is again very important. So according to naturopathy, external treatments, whether it is natural or Ayurvedic, whatever, that is not uh, going to cure it. It is going to suppress the symptoms. So instead of treating the symptoms, we have to focus on trying to treat holistically and remove the foreign matter, correct the physiology and correct the physiological functions, all these. And plus, we have to promote the healing procedures. The finally, patient's own will to get well and determination and faith are very important. So whatever the treatments the patient is taking, the patient's determination and faith should be very strong so that they won't fall sick too soon. And they have to see the person themselves should know the importance of health, and their aim in life also should be health, because some people are not aware about health also, and they are not considering itself as a requirement in their life that health is very important. So it is very important that we have to advise them that health is important, so and that will be good for them also and to the society also. So thank you so much for listening to the health talk. So I think the information was useful for you. Thank you.
So I, Dr. Arya, on behalf of all our viewers, would like to extend my heartfelt gratitude to Dr. Jyotsna ma'am for her wonderful and insightful talk on the occasion of World Health Day. Your session was truly inspiring and informative, ma'am, and your vast experience in naturopathy and yoga was clearly reflected in the depth and clarity of the talk. So I would also like to extend my sincere thanks to our principal and the management for providing us with this valuable opportunities. Once again, I thank Jyotsna ma'am, and all other viewers. And I ask all the viewers to kindly stay tuned for our upcoming Health Talk series. Until then, it's thanks and regards from JSSI Inways. Thank you.